Hey everyone, Kim Hollander with the Oxalosis and Hyperoxaluria Foundation. We're incredibly excited to have you with us today and for you to be joining our OHF On the Road Summer Webinar Series. Today's really exciting. This is our first session for the summer, and this is about tips for finding financial assistance. We're incredibly excited to host this webinar. And we've heard a lot of people complaining about high medical out-of-pocket costs. And this webinar is designed to help eligible individuals learn about opportunities for their out-of-pocket medical costs for treatment, such as copayments, health insurance, premiums, and incidental medical expenses related to hyperoxaluria. We want to thank our incredible sponsors, especially Alnylam Pharmaceuticals and Dicerna Pharmaceuticals, for their tremendous support, and to all of our sponsors for making a difference today and allowing this webinar series to happen. We have a really fantastic lineup today of guest speakers. First is going to be Jeremy Amundi from the Healthwell Foundation. Next will be Stephanie Marshall from the Assistance Fund. And then finally, Michael Spiegler from the American Kidney Fund. We want to thank all our panelists for making a difference today and for helping educate the OHF community about such incredible opportunities that are available to help patients living with hyperoxaluria. A few things. Today's webinar should last about an hour, maybe just a little shy of an hour. All participants are actually muted so that we have no interruptions, but we really encourage you to hold all your questions until the end and use the chat feature and the question and answer at the bottom of your screen whenever you want to ask a question, and then we'll funnel it towards the end of the webinar, and hopefully we'll get to everyone's questions. If we don't, we'll respond at the end afterwards. You can also check this out at any time on our OHF Facebook page and YouTube channel. So if you want to share it with friends and family or anyone else that you know is living with hyperoxaluria and cannot be on this webinar, you can do that at any time. So let's get started. Love to introduce our first speaker, Jeremy, who's the manager and provider and pharmacy relations at Healthwell Foundations. Jeremy, go ahead and unmute yourself and please show your video.
Great, thank you so much, Kim. I appreciate the warm introduction. Hello, everybody. Really happy to be here with you today to discuss the Healthwell Foundation and how to apply for copay and premium assistance in less than 5 minutes. It really is a simple process. We're going to walk you through it. We won't have time to go step by step, but we'll give you the highlights, give you the tools you need, and then if there's any questions after today's webinar, my contact information will be included in the slides. Please feel free to reach out to me. Next slide, please. And next slide. Okay, just a brief level set. Again, I'm going to introduce Healthwell. We'll dive into the application process, give you the tools that you need. I'm going to highlight a new fund feature that we're really proud of, our real-time fund alerts. And then, as I mentioned, I'll provide my contact information at the end in case you have questions. Please feel free to reach out to me. So let's get started. What is Healthwell? Healthwell is an independent national 501c3 organization. We're based here in Germantown, Maryland. We were established in 2003 to improve patient access to life-changing medical treatments. And since launching our first fund in 2004, we've provided assistance to over 80 different disease funds. As of December 2020, we have approximately 160,000 active patient grants in our system. And since our inception, we've awarded $2.1 billion in payments to over 615,000 patients across more than 930,000 grants. And a key takeaway for today is to please understand that 100% of all donated dollars go directly to patient grants and services and never go towards fundraising or any admin costs. Next slide, please. Okay, so let's discuss the grant process and how does a patient qualify. Basically, there's 3 criteria. It's really that simple. In order to qualify, a patient must have some form of health insurance, either medical or prescription coverage, have an income of less than 4 or 500% of the federal poverty level, depending on the fund. And for the hyperoxaluria fund, it's a 500% federal poverty level, depending on household size. And finally, the patient must be receiving treatment for a specific medical condition for which funding is available. If funds not open, we can't provide assistance. Pretty straightforward. Next slide. So how do I apply as a patient? There's two ways. You can either contact our call center by phone, and the numbers there listed, or you can absolutely go online and apply. And to do that, you'll go to healthwellfoundation.org. And from there, it's pretty straightforward as to how to apply, but we'll explain further. And the beautiful thing about applying either by phone or online is you receive instant approval. If you are approved for a grant, you're going to know walking away by the end of that phone call or by the time you log off the computer whether or not you've been approved. Next slide. So information you need in order to apply, pretty straightforward. Your date of birth, your name and address and phone number. You'll need your insurance information, your social security number, and then again, your household size and annual household income. Next slide. Okay, so let's talk about how to apply. Very straightforward. Go to our website, healthwellfoundation.org. And the first thing you want to do is to click on the disease funds to verify that the medication that you're requesting assistance for is in fact covered by the fund that you're applying for. Pretty easy to do that. All you'll do is click on that blue disease fund button you see at the top center of your screen. Next slide. Once you've done that, you'll select the disease fund that you're going to apply for. In this case, I've chosen the Hyperoxaluria fund. And all the information you need to know about the fund is listed there for you. So you'll see here, status of the fund is open. Obviously, that's important. The fund type is copay or premium assistance. And as you submit your application, you'll be asked whether you're requesting assistance for copays or actual insurance premiums, and you have that choice to make. The maximum award level is $8,000 per year. Your grant is good for a year from the date that you're approved, and you are eligible to reapply once that 12-month period expires. It's a pharmacy card fund program. So what that means is if you choose copay, you'll receive a pharmacy card. You'll actually be able to download it off the screen and have that information immediately, and you can begin using your fund immediately if you're approved. There again, you'll see household income limit, 500% of federal poverty level, and that's adjusted for household size and high cost of living areas. And most importantly, you'll see treatments covered. And this is where you're going to want to scroll through and make sure that the medication that you're on is covered by this fund before moving forward. Next slide, please. So once you've done that, you've confirmed that your medication is covered by the fund. Scroll to the bottom of the page and you'll click on the apply/re-enroll button. And here, I'm not going to go step by step just for the interest of time, but it's a very simple process. And you'll just simply follow those prompts. It's going to ask you things like which fund you're applying for, what medications you're taking, and you must be taking a qualifying medication in order to be eligible. Whether you have insurance for the requested therapy, and which type of assistance you're applying for. Again, copay versus premium assistance. Once you answer those questions and enter that information, you'll then be prompted to enter your name and contact information, your household size and household income, your doctor's name and contact information, and finally your insurance information. Next slide. Once you've entered all that information in the system, you'll land on this final review page. Please take a minute, make sure everything is correct. If it's not, you can edit each individual section. So no worries if you made a mistake, you can go back and change it. Once everything is up to date and correct, you'll click the submit button at the bottom of the page. Next slide. And that's it. It's really just that simple. Congratulations. If you're approved, you'll have instant access, like I said, to your pharmacy card. And I've got a sample card there for you. That gives you all the information you'll need to provide to your pharmacist in order to fill a prescription. We also offer direct billing with providers and pharmacies. And as I mentioned previously, eligibility to apply for after 12 months. So your grant is good for 12 months. Once that period expires, you can then reapply for a future grant moving forward. Next slide. And then, as I mentioned, I just want to highlight one key feature that we were very happy to offer to people, our real-time fund alerts. And what this does, especially for funds that are in high demand, it allows you to track the status of those funds, whether or not it's open to closed or vice versa, and gives you updates. It is mobile friendly, so you can access that on your mobile phone as well as on the internet. If you're a patient or provider, you can access that information through our website, through our portals. We have a patient portal and a pharmacy and provider portal. But if you're not, no worries. You can also still access our portal. And to do that, you'll simply go to our website at healthwellfoundation.org. You'll see a yellow portals tab at the top of the screen, and you'll want to click on real-time fund alerts and then create an account. And once you've registered, you can then select which funds you want to get those updates to, and you'll begin receiving updates for those respective funds. Next slide. So like I said, in the interest of time, we covered a lot of information. I know there's probably questions. If you happen to have an existing application or grant already in our system and you have questions pertaining to that, please contact our grants department, grants@healthwellfoundation.org. But if anything we've covered today that you have questions about, please feel free to reach out to me. My contact information is there for you on the screen. And with that, I'll turn it back over to Kim. Thank you, everyone.
Thanks, Jeremy, for that incredible overview. That was really helpful. And we did get some questions that we'll come back to at the end of the webinar so that everyone's question can get answered. So next, I would love to introduce you to Stephanie Marshall, Director of Patient Advocacy from the Assistance Fund. So Stephanie, I'll ask you to unmute and turn on your camera and get started.
All right. Thank you, Kim, for that kind introduction. It's a pleasure to be with you all today to talk about the Assistance Fund and our programs for support. So next slide. I'd like to just take a few moments today to talk about the Assistance Fund, our primary hyperoxaluria program, including how to apply for assistance and ways you can contact us. So next slide, please. The Assistance Fund, or TAF for short, is an independent 501c3 patient assistance organization. We help patients and families facing high out-of-pocket medical costs by providing financial assistance for copayments, coinsurance, deductibles, and other health-related expenses. We manage more than 70 disease programs, including one for primary hyperoxaluria. Each TAF program covers the FDA-approved medication for that specific condition, including for PH. And once a patient applies and is approved and enrolled in a program, there is no cap on the amount of assistance they can receive in a calendar year. Next slide, please. This past spring, TAF launched a primary hyperoxaluria financial assistance program that helps cover the following costs: prescription drug copays, deductibles and coinsurance, health insurance premiums, therapy administration, travel-related costs for treatment, and genetic testing. To obtain assistance, you must apply for coverage and meet the eligibility requirements. Next slide, please. To be eligible for assistance, you must be a U.S. or permanent resident, meet certain income requirements, have a diagnosis of the disease named in the program, have health insurance such as Medicare, Medicaid, commercial insurance, or health exchange coverage, and have a prescription for an FDA-approved treatment for the condition named in the program. As I mentioned, TAF has more than 70 disease programs. Sometimes, due to limited funding, programs are not always accepting new patients. When that is the case, a program has a wait list. Our primary hyperoxaluria program currently has a wait list, but I don't want you to be discouraged. It's always possible that if additional funding becomes available, we can invite patients from the wait list to join the program. Regardless of whether a program is accepting new patients or has a wait list, the application process is the same and must be followed. So let me take a few moments to explain how the application process works. Next slide, please. There are several ways to apply for assistance: online, over the phone, or with a paper application. You can go directly to the primary hyperoxaluria page on our website to submit an application, and if accepted, you would be placed on the wait list. We also have a dedicated phone number for the PH program. Our patient advocates can answer any questions you might have and can also help complete the application with you over the phone. If you apply online or over the phone, we'll let you know immediately if you're eligible for assistance. Online applications can be submitted 24/7, and our call center is staffed Monday through Friday during regular business hours. A paper application can be submitted by electronic upload or fax. Next slide. Since the primary hyperoxaluria program is waitlisted, I want to explain how this process in particular works. To secure a place on the waitlist, you must complete an enrollment application and meet the eligibility criteria. If your application is accepted, you'll be placed on the waitlist. When funding is available, TAF will issue an invitation to you to join the disease program, and patients have 48 hours to accept or decline the invitation. Those who accept will be immediately enrolled and coverage becomes active immediately. We understand that many patients and caregivers will want to periodically check their status on the waitlist, so we've created a waitlist hub on our website. By entering a few pieces of information, you can check your status at any time. Next slide. I know my presentation was brief, but I hope this information has been helpful to you. I encourage you to visit our website at tafcares.org. You can also call our dedicated PH program phone line to speak with the patient advocate and get all your questions answered. And I hope we'll put the phone number and the website in the chat. And for those who are active on social media, feel free to follow TAF on your favorite platform. Next slide. So thank you again to the Foundation for inviting me to be with you today and for sharing the information about financial assistance. And thank you for your time. And it's a pleasure working with you, and I look forward to answering your questions. Thank you.
Fantastic. Thank you so much, Stephanie. What a great overview and just a recap of potentially what funds could become available. And of course, at OHF, as soon as we get a notification that those funds are available, we'll certainly educate the OHF community through Facebook and through various channels. So keep an eye out for those as well. Our next speaker is Michael Spiegler from the American Kidney Fund. Michael is the Vice President of Patient Services and Kidney Disease Education. So Michael, welcome and thank you so much.
Thank you very much, Kim, and thanks to the OHF for hosting this today. I'm sure it's going to be extremely helpful. I want to talk a little bit about some of the services offered by the American Kidney Fund and our financial assistance programs. We are a national nonprofit 501c3, like the other organizations that are here today. We have a wide range of education programs, both public education, professional education, research, really the whole gamut, including information on PH. But I really wanted to focus today just on those financial assistance programs. So next slide. So starting with our first program, so our safety net program is the oldest program in the American Kidney Fund's catalog of programs that we have. This was started back in 1971. It was before dialysis was covered by any kind of assistance programs. And back then it was a group of neighbors that got together to help pay for the treatment of someone who did not have insurance or coverage for dialysis. The program has grown from just a few people to now serving 1 out of every 6 dialysis patients in the country and about 2,000 transplant patients in the country every year with assistance programs. Our safety net program is the first one I'll talk about. It is a $100 grant once a year, which does not sound like a lot, but it usually makes a difference for patients who, have an unexpected copay that they can't cover, or gas in their car for an unexpected repair, those kinds of things. Anything that is treatment associated, this program assists with. And to be eligible, it's for any dialysis patient that is living and residing in the U.S. and also recently transplanted patients up to 5 years post-transplant. We are very fortunate in the Maryland, DC, and Virginia area that we have a private foundation grant that allows us to offer $250 grants in those locations. Next slide. We also have a disaster relief program, which I must say we've been very fortunate to have not had to turn on thus far this year. But this is a program that we rapidly turn on for any kind of natural disasters, wildfires, earthquakes, hurricanes, flooding events. This program has obviously been huge. The flooding in Houston a few years back was one great example of that. We decided, in working with CASER and some other organizations and boots on the ground, to understand when to turn it on. The key is really if someone's been displaced from their dialysis center, or they've lost their home or their medications or their food, to make sure that we turn this on and get assistance to patients. Depending on the funding and the size of the disaster, these are usually $250 grants. It can change sometimes, but we are working really hard to get those grants out as quickly as possible. And actually, a new feature of this program, this used to be mailed checks that we would send out. And as you can imagine, in a large disaster area, as Hurricane Maria in Puerto Rico a few years back, there may not be even mail service. So We are working now to offer EFT, so a direct deposit, and also debit cards as well that are available for patients to get them their grants faster. So again, this is case dependent. You know, we usually, if we know a large hurricane is coming, we'll start turning this on even in advance of that. What we don't want are for patients that are on dialysis that don't have the money to afford a motel room or a hotel room to get out of town, to make the decision to shelter in place and put their lives at risk when they could get out of town. So if there are mandatory evacuations, we will usually turn the program on as well to make sure people get to safety. Next slide. Our newest program that we have at the American Kidney Fund is our post-transplant testing program. So many people may not be aware of these new tests, relatively new. I guess some of them have been out for a few years now. I think there are 3 or 4 companies that are offering this, but it's donor-derived cell-free DNA testing. Basically, it's a test that can help identify signs of rejection in a kidney transplant before it starts to happen, but well, at least before you start to notice it from a functionality standpoint. It's for any of the major companies that are involved with this program. It assists patients up to 10 years post-transplant. The eligibility for this program is up to 500% of the FPL, similar to some of the other programs you saw today. And that is household size dependent as well. And it's for out-of-pocket costs regarding with this blood test. It's up to $1,200. We can assist with this. It's relatively easy to apply for it. You just need a form from your nephrologist stating that you had this test done and that there are out-of-pocket costs associated with it. We can get it out. The program is wide open right now. We have plenty of room for new patients who are looking to do that. For those of you not familiar with the test, we do have a blog we've added to our website as well to talk about that. It's really good for patients that can't get a biopsy for whatever reason, maybe live in a rural area, can't get to regular biopsy appointments to check the status of a transplant. It can be very, very helpful for patients. Next slide. So our biggest program, probably the one that most people in the kidney community are most aware of, is our health insurance premium program. So this was a program started back in 1997. It was given to us through an opinion from the Office of Inspector General at HHS to do this program. And basically what it does is it covers the health insurance premiums for any kind of health insurance for dialysis patients, whether it's a COBRA premium. You know, many patients about a third of patients crash into dialysis with no warning, able to maintain their insurance with their employer, their EGHP. From the exchange programs, there are a few Medicaid programs around the country that often have premium associated with them as well. But the primary use case are Medicare patients. Over 60% of our assistance are to Medicare Part B premiums or Medigap plans, or now the kidney patients are available to get Medicare Advantage plans, those as well. There is no limit to the upper end of that assistance, provided the pool is open. We very rarely have to shut it down to new patients. And if so, it's usually very short hold that we do that. So we can pay with up to 2 insurances as well. So, you know, if you're on Medicare and you have Medigap, we can cover both your Part B premium and your Medigap premium as well throughout the duration. There's no limit really as far as upper limit on duration for the program either. But it's extremely life-saving program for patients, especially for people that may have been the breadwinner for their families and are trying to stay employed or keep their insurance in place when they're suddenly faced with trying to battle kidney failure as well. Next slide. And one thing that I'm very proud of, I guess it's been about 2.5 years ago now, we have extended this program to transplant patients as well. So up to a policy year, it's like, I think the upper limit is about 15 months that we can assist transplant patients. So once you are transplanted, your assistance will continue. What we did not want to do was leave people in the middle of like a policy year and not be able to afford a plan. So we make sure to assist that program. And as part of doing that, we started to track to see how many of our health insurance premium program patients were receiving transplants. And just last year alone, 1,615 of our patients were transplanted, which is about 7% of all the kidney transplants in the US. And because the nature of our grant pool are patients that are financially struggling, of lower socioeconomic status, it's a much more diverse pool than the national transplant pool. The patients that we're assisting getting transplanted very likely may not have gotten it without our assistance. So we're very proud of this program. It continues to grow. About 120 patients each month are getting transplanted with our health insurance premium program. Next slide. And while this program is now closed, I wanted to talk about it just to show that, look, no one wants a pandemic or anything like it in our lifetime ever again. But if something like that happens, ACAF is very nimble. We're usually putting programs together when they are necessary. And this is one example of that. We gave out over $3.1 million to patients during the pandemic, most of which were just from financial impacts of the pandemic. You know, many dialysis patients, as I'm sure you all know, are not able to work. Those that did, many of them were in the service industry. So when the economic part of the pandemic started to affect them as well, we were there to help with that program as well. We were completely overwhelmed when it started. We were able to get some great assistance from corporations, foundations, and individuals to step up to help fund this program. But they were small $250 grants, so you can imagine how many of those that there were to get to 3.1 million. But I just want to put that out there to say, you know, something extraordinary is happening and is affecting kidney patients. Please check our website and make sure that we haven't started to do something to try to help with that, because we are usually there for patients in that time. Next slide. So let me talk about how you apply. The easiest way is through our grants management system. That is our proprietary software that we use to manage our grant system. Next slide. And there are a couple ways to manage this, but really anybody can do this. So it can be your social worker, your transplant coordinator. You can do it yourself. You can even have a caregiver do it for you. So I know there's probably a lot of parents on the line today, and you know, for your child, you're able to go in and do that as well. But it's all online. It is relatively simple. Lots of tutorials on there as well. We obviously additionally have a phone number that you can call if there's any issues as well. We have a way to set up appointments of 30-minute blocks for people. And our hope is next year actually even adding a chat function as well, so that patients have lots of ways to get these in. Next slide. And finally, again, the easiest way to do this, if you have a transplant social worker, if you have a dialysis social worker that you're working with, I would say 90% of them in the US are familiar with our programs and how to get into our grants management system. They can do that for you. But if you do want to do it on your own, which we certainly welcome, our website is gms.kidneyfund.org/login. You can also just go to our kidneyfund.org website. Right at the top, you'll see the GMS button on the left-hand side to log in there as well. But turnaround time is usually pretty quick. From the time an application comes in till a check is out the door, if you are approved, is usually no more than about 10 days. So we're very, very quick, even though we have lots and lots of applications coming in. We work really hard to try to turn that around, and it's something we all strive for. Next slide. I think that's it. I welcome any questions along with everyone else. Thank you guys very much for your time, and thanks to OHF for the opportunity today.
Hi, everyone. My name is Julie Bertarelli, and I'm the operations coordinator for OHF. Kim is experiencing some technical difficulties, so I'm going to see if we can pull up these questions that we have here for you. We have one for Jeremy that just came in, and thanks, Jeremy, for your presentation. It was amazing as well. Can a parent apply per child, per family, or family with more than one child with PH?
Thanks, Julie. The short answer is yes, absolutely. Parents can apply. You will need to provide your information as well as your child's, obviously, but you can absolutely apply on behalf of a patient or a child. And likewise, caregivers, loved ones, that kind of thing, doesn't have to be a child. You can also submit on their behalf as well. And you'll see that prompt when you go into the online application. It'll ask you to indicate whether or not you're the actual patient or whether you're applying on behalf of the patient.
Great, thank you. And we have a question from Christy for Stephanie. Does TAF cover dialysis as a disease management?
Thanks, Julie, and thanks for that question. You know, TAF was founded to provide assistance for prescription drugs for medication. So that is still our kind of the heart of what we do. And we work very hard to provide a full range of assistance. At this time, we do not cover dialysis, but certainly as our programs may grow and as more funding becomes available, we would certainly like to be able to provide support for dialysis under disease management.
Great, thank you. Next question for Michael. Are American Kidney Fund's programs available to patients who are undocumented or not citizens?
Yes, they are. So the only qualifications as far as where citizenship goes, you have to live and reside in the U.S. or one of our territories to receive assistance. We do not check citizenship status at all. It's just not a question that we ask one way or the other, but you do have to live and reside and receive treatment in the U.S. or its territories. But thank you, good question.
Great, thank you. And for Jeremy, if I am approved for a Hyperoxaluria Fund grant, how long will my enrollment remain active?
Great question. We get that all the time. It's 12 months from your approval date. So it'll 12-month period. And at that point, once that time period has expired, you'll be able to reapply. Follow-up question we get to that a lot is, if the fund closes, is my grant still good? Absolutely. Once you've got your grant, that grant will be honored for the entire course of the year. You want to think about an airplane. They sell an amount of tickets. Once tickets are full, seats are booked, we stop accepting applications. Same thing in our case. Once you've got your grant is good for that entire year.
Great, thank you. Also, Jeremy, what's the maximum award level for that Hyperoxaluria Fund grant?
Absolutely. It's $8,000 per grant per year.
Okay, great to know. Stephanie, is there a cap on assistance?
No, there is not, Julie. So our program does not cap the amount of assistance we provide in that calendar year.
Okay, great. And for Stephanie, do I need health insurance to participate in the program?
Yes, insurance coverage is required. So again, it can be Medicare, Medicaid, private insurance, commercial insurance, insurance purchased on the exchange, or TRICARE as well.
Okay, great. And our last question for today, if we don't get to answer some of your questions, we definitely will send you an email afterwards. Do I need health insurance to participate? Oh, I already asked you that one. How do I apply for assistance, and how long does it take to determine eligibility, Stephanie?
Thank you, Julie. So yes, assistance, you can make application online, over the phone, or by paper. And if the application is submitted online or by phone, you'll be immediately told whether or not you qualify for assistance. So eligibility and coverage begin immediately.
Great, thank you. So I think those are most of the questions that have come in. Again, if there are any other questions that do come in, we definitely will email you after this webinar to get the answer to you. You can always reach out to us at ohf.org as well. Kim, are you able to do next slide? Great. We have 2 upcoming webinars, which we actually want to remind everybody to join. One is our session 2, July 27th, 2021, Your Voice is Vital. And also session 3, August 17th. Since if you have already registered for the webinar, you definitely will get a notification for these 2 upcoming webinars. And I really first of all, I want to thank our speakers. I want to thank Jeremy and Stephanie, and I want to thank Michael, and what an amazing job they did today, that they're able to share all this with you. Again, it probably went pretty fast for everyone, but we can definitely follow up with you at ohf.org. Just, send us an email. And we want to thank our sponsors today. This wouldn't be possible, of course, without them. And we want to mention Alnylam and Dicerna as our partner sponsors today. And that is the end of the webinar. And we thank everyone for joining.